Hi, and welcome to today's Venture and Capital interviews. Today I have Dr. Ruchi Dana, who's a board member of the Dana Group, which is actually the family office. And, Dr. Ruchi was actually just recently part of our panel session. And, one of the areas we were sort of talking about, and obviously we're looking at it from an international perspective. And the key areas that we sort of want to go through today is talking around sort of medical devices and healthcare. So welcome, Dr. Ruchi.
Thank you so much, Steve. It's my pleasure, and this is an area that really is very, very much in line with my investments because I'm a doctor myself and I look after investments into healthcare. So I'm really excited to be here. Thank you so much.
No problems. And just using that as a starting point, how did you actually get into the investment side, and sort of how do you sort of, I suppose, do you still practice as a doctor, or is now you sort of focus on just purely the investment side and sort of the research on the different investments that you're in?
Sure. So, no, I don't practice anymore, but I'm a trained medical practitioner. And then after that, I did my MBA from Stanford. And at Stanford, I also took the Stanford Biodesign course. So what happens there is that it's at the intersection of various disciplines. So there are doctors, engineers, lawyers, PhD students, MBA students. Everybody comes together to solve for unmet clinical needs. So a lot of medtech innovation actually comes out of that program, like the Stanford Biodesign program. And we invest quite a lot into these medical device companies that come out of that program, and like mainly in the US, because although we are a family office based in the UAE in the Middle East, but like there's not enough research or like medical device companies that come out of this region. We are hoping that something comes out of this region as well. But at the moment, our main investments have been in the US and South Asia.
Fantastic. So you say Southeast Asia?
South Asia, yeah. Like India, a little bit of Bangladesh and all, yeah.
Fantastic. And just say, like, I know sort of, Australia has obviously invested a lot of money into the life science area, both the biotech and medical device. And obviously we're sort of proud of our history in the sort of medical device area. So, whether it be from, Cochlear as a company, whether it be through to, we've had some recent companies like Atomo Diagnostics list on the Australian Stock Exchange, and also 4DX or 4D Medical, which is a medical diagnosis sort of image. So for me, like when I sort of look at this area, I said I got passionate about this as a space because of one of our clients on the sort of biotech side. For you, moving into the investment area, how did that sort of start, and what was your thesis at the time, and how has that sort of changed over the years?
Sure. So one of the things that we do is like we do direct investments in these medical device companies. And one of the main reasons for that is that we're a family of doctors. So I'm a doctor myself. Both of my parents are doctors. My brother is a doctor. And we all went to different medical colleges. So we have our own network of doctors to check, like just to help in the due diligence process. So that's the reason we have stuck to the like medical device and biotech region, because like if a deal comes in the region of fintech or something, we really are not the experts in that. So we'd rather like invest through a fund. But in healthcare, that's something that we have grown much more comfortable with. And our thesis has mainly been like investments outside of the Middle East. And the main reason behind that is that our operational family business is very much concentrated within the Middle East. So that's the reason we would like to diversify outside of the Middle East. And the other reason for that is that there's not many colleges and universities in this region that bring out like a number of like medical device companies, and also that's the reason again that we look for investments outside of the Middle East. So that's been the thesis mainly like in the healthcare sector. But like year to year, we just watch out for the trends that are upcoming. So currently we're also looking at the longevity space, which we never looked at in the past, but now we're getting very excited about it. We made an investment into a genetic testing company, and a microbiome testing company. And I think there's so much more that can be done in this space, because like as we move forward, like eventually like things would move in the arena of personalized medicine. Like you don't need to give like the same dosage of medicine to each and every person. The dosage would depend on the microbiome in the gut, and also like a lot has to be done in this region. I think we are still very early in the microbiome research space, but I see that there could be a lot of things that could be done. So this is a company that we invested in India. And in India, like microbiome is a very, very nascent research phase right now, but like let's see how that goes. And apart from that, we're also at the moment investing a little bit into elderly care, and that's mainly from an impact angle, but I see a huge need in that region as well, because I recently read the news that around 500,000 nurses from Philippines were actually sent to Japan just to take care of the elderly population there. And I see this is a huge need,
Mm.
like as and when like the millennials are growing up, they're getting separated from their families, even in places like India and all, and like the parents are left alone and they're not very digitally and tech savvy. So a lot of apps that could be built around like the security of the parents, and like to make like small things like bill payments and electronic payments and all, that the children could do on behalf of the parents. So like these are the things that we are looking at the moment. And apart from that, like home health is something that definitely we are interested into.
Okay, so the four key areas, and hopefully I remember this. You mentioned home health. You mentioned obviously the sort of genetics and sort of gut biome and so forth, and then also medical device. So the sort of robotics and medical device was a sort of first area, and I'm forgetting the fourth. But we'll start. Can I start on the robotics as an area? So my personal experience is my wife was experiencing sort of hypothyroid,
Yeah.
and basically she went to Korea to have the surgery done. She had to get part of the thyroid removed, and it was done via, it was basically a robotic surgery. And I
Yeah.
was absolutely astonished at the lack of scarring that remained after it. And so I'm curious, I would love to know more about the sort of startup that you're involved in sort of that area, and what you see as that potential for the sort of for for robotics in the medical surgery area.
Sure. So if we talk about like robotic surgery, it has been around for more than 20 years now. The
Mm,
first robot for like doing surgeries was actually built in the 1990. It was mainly for the US Army, because they thought like during the war in Afghanistan, they thought like they could remotely take care of the soldiers that got
mm,
injured. But that couldn't happen back then because there was no 5G. So, but like if you look at the traditional robots that are around for robotic surgery, the surgeon sits in a cockpit like area, and the patient is in a separate room. But like there was no 5G connectivity. So like, but the design of those robots are still the same. It's just like small innovations, small improvements that have happened over time. So I personally am also working on a robotic surgery startup. It's actually a low cost robotic surgery
mm,
device. And so one of the challenges that we face with robotic surgery is that it's unable to penetrate like emerging countries, and there's a
mm.
huge need in these countries, but like simply the cost of these robots is so high that not everybody is able to afford this. So we're trying to bring
And when
down
you
the
say
cost.
not everybody, you mean the hospitals, right? Because it'll be typically the hospitals that be buying this equipment, and then.
Yeah, it's mainly like the hospitals and clinics, but with this current startup, the price of the robots has gone down to $100,000. So we are eventually aiming, even like orthopedicians could buy the robot themselves, for because
Wow.
oftentimes what happens is like the doctors, they go from one operation theater to another. They use different operation theaters, but they can carry the robot themselves. So this is like something in the near future that could become a reality, but at the moment it's still just in the prototype stage. But what I can see right now is that robotic surgery is getting the right tailwinds, especially because of COVID-19. Because as you
Mm,
mentioned, like the scar is so small, so the
mm.
chances of infection are less, and then it becomes a daycare surgery. So you don't need to stay in the hospital for like 3 days or 5 days, and that's actually freeing up resources for like the COVID patients. And even the operation theater itself, since you have a robot with you, you don't require extra nurses or extra doctors in the operation theater. So it's been like saving a lot of resources for the hospitals themselves, and for the patient definitely like it's a huge advantage, because you don't get the risk of acquiring hospital acquired infections or
It's
like.
actually astonishing. If anyone ever does the research on how many people die via infections inside hospitals,
Yeah.
like yeah, when I found that out, because there's another Australian company called, I believe it's Nanosonics, is the one that's sort of targeting that as an area, and once again a successful listed company. But when I was sort of doing the research in that area, I was absolutely astonished how many people die inside hospitals due to infections.
Yeah. Yeah, and as people are getting much more and more aware about it because of COVID-19, I think like telehealth
Mm,
would take up would be adopted in a big way, because like now people realize that the chances of infection, even just going out for a doctor's visit, actually exposes you to a number of infectious
correct.
items, right? So that's the reason I think telemedicine would really work out in the future. We didn't make any as such investment into telemedicine because at the moment I think like the startups are valued like really high.
That's because it's their time in the spotlight. It's their time to shine.
Yeah, yeah. But I can see like the telehealth companies have been around for a long time, but now
Yes,
suddenly they're getting a lot of adoption, and I think it's here to stay. Like Zoom would be here to stay. Similarly, like a number of telehealth companies would be here to stay. I'm actually an advisor to one of the companies, but like we're not like direct investors into any of the telehealth companies at the moment, because when you think about startups, like most of the startups are getting like down rounds or bridge rounds and all, but like healthcare startups are actually booming right now.
yeah,
So
healthcare and technology are both going through the roof at the
yeah,
moment.
yeah, yeah.
And funny enough, that story I just told you about, we've had three of our clients that we've worked with sort of over the last sort of 5 years. They've all just recently listed on the ASX. And
Oh,
as I mentioned, Atomo Diagnostics was one. They've got a relationship, where they've received funding from the Bill and Melinda Gates Foundation. But 4D Medical, what I sort of liked about their approach was effectively what they were doing is they are effectively taking an X-ray machine that sits inside of a hospital and repurposing it, and then overlaying a subscription model with software to overlay more imaging and more data to be sort of extracted from that. And like most good Australian or most strong Australian life science companies, they of course have moved to the US to continue their
yeah,
expansion.
yeah.
And just with that as a sort of area, the other one I would love to touch on with you and understand what your thoughts are, and what you're seeing is that you said around gut health, because for the last, I would say, 6 months, it's been a lot. Anyone that sort of listens to any sort of health podcasts or sort of reading information in that area, you sort of, it's hard to underestimate the role that gut health plays in an individual's health, and not just their health, but also their emotions. And especially at a time like this, the immune system and so forth. So, firstly, I'd love to hear from you your perspective and why you're going so long into this area. And then, secondly, where you're making your investments in this space and where you're looking to make investments.
Sure. Yeah, even as a trained doctor, like we were never taught about like gut health and all,
Mm,
because that's something that's considered like alternative medicine. But there's been so much research coming out in this region in this aspect, and then like just last year, the Indian microbiome project was launched. So that's when things got really exciting, because India has like a number of spas and ashrams and all, where a number of
yeah,
expats actually come to get their like irritable bowel syndrome and all get cured, and they actually get a lot of relief there. But like there's no science behind it to actually prove like what's happening there is actually true. So I think like with the Indian microbiome project, there might be like some sort of science that could come behind like the entire ashrams and spas that are working around to create like to cure ulcerative colitis and Crohn's disease and all. So I thought that this would be an interesting area to invest into. And then like the more we went into the due diligence process, we realized that like there's a gut brain axis that can entirely affect like even Alzheimer's disease and a number of
mm,
diseases that are associated with the brain and psychiatry. And also, so that's a huge link, I think. Like there's so much to be done. I think we are just at the tip of the iceberg. There's so much research still to be done in the microbiome area.
agreed.
Recently, even for COVID, I think there were a number of research papers that came across that the virus is actually shed in the fecal matter. So that actually, and like the initial symptoms of COVID are around diarrhea and things like that. So that again shows there's so much to be done in this aspect as well. I think we're at a very early stage right now in the microbiome area, but I can see a huge
Yeah,
potential. And I thought that like this would be the right time to enter, because there's so much to be done. And one of the other aspects about like this data is like if you combine this data with the genetic data and the EHR data and all, then you'll get like so much more precious information out there. Like if you think about like the age and like the other demographic things, for the data for the same patient, and if you get the genetic data for the same patient and the microbiome data for the same patient, then you're able to analyze a huge number of results. And I think there could be like some cures for certain diseases as well. At least you can reverse certain diseases, that's for sure. And the thing is that like chronic diseases are a huge burden to the healthcare system. And I think with the
Correct.
help of like proper analysis of the genetic makeup and the microbiome makeup of a person, we can actually like really slow down that burden and actually like reduce the doses of medicines in certain people, because like there's no need to give like high doses of medicines into people when it's actually not being absorbed by the body. Like it's
Well,
better to, yeah.
especially in the like you look at the mental health area. Like I said, I've seen it with I've seen it with people that are on sort of whether it be different drugs related to mental health, and you can just see the way that it sort of impacts them emotionally, it impacts them physically, and it's very difficult. And then part of that is you just think, and there's actually another one of our clients called NeuroCare Group is actually looking to not just the looking into mental health as an area, but not okay, let's supply you with drugs and see how you go. They've basically built 15 different practices now where they're looking at diet, they're looking at gut bacteria, as far as it's in their mind, as far whether it be probiotics or prebiotics. And then also just and how that actually impacts someone's emotion, even things like breathing as an area. So for me personally as a founder, and I'm sure like you've got a busy schedule. So we will do anything for more mental energy and more physical energy. How are you seeing that research that you're looking at into sort of into the gut and into the microbiome? How are you seeing that impacts people's sort of mental health?
Yeah. I think there's a huge link, because there's a gut-brain axis that actually has been discovered. It was like written in like previous histories as well, about like a lot of research had been done about like the link between the gut and the brain. And as we go forward, I think like probiotics, prebiotics, that's one area to definitely look at. So there has been like some sort of research that if you take the microbiome from a person who's like for example like the Boston Marathon runner or like and all, and you try to replicate that and create more of that and actually sell it in the market, there'd be people, there's a huge market for that, right? Similarly for mental health as well, there could be like some sort of research that's going on right now, but it's not yet proved. But like there could be things like if you could have like certain probiotics, prebiotics just for like relieving stress and anxiety and all, I think that could be a natural way to actually go forward, because mental health is becoming crisis right now, especially because of COVID-19, because people are living in isolation, there are a number of job losses. And even in children, I'm surprised like how would the social development of kids happen in the near future, because they're not interacting with other people, right? Other children. And that's making children much more introvert. And also, so the next generation that would come out, I think COVID would have a huge effect on the mental well-being of the entire generation. So let's see. In terms of microbiome, it's still a very early phase right now. And one of the things is that like with the number of probiotics that you take, like the actual percentage of microbiome that actually reaches the gut is very small, because like there's stomach acids and all that actually like sort of kill the entire microbiome. So that's another thing. Like the efficacy of these things is really, so there have been companies that are
working. So you mean my
on
morning routine of probiotics and whether it be a shot, and also my making sure I've got it refrigerated and the tablets, and making sure I've got 50 billion whatever the measurement is it may not be as effective as what I desire.
Yeah, that's true. And there are companies that are actually working on the encapsulation of these things, because there are different pHs, like pH in which like the pills and the probiotics go through. So that's where like a number of bacteria are already killed. So there's one more theory about actually having like fecal transplantation of the probiotics, but I'm not sure how many people would go ahead with that.
The other part I'm curious, like the other thing is becoming popular sort of in Australia, and I'm sure you're sort of seeing it as well, where it's that sort of thought as far as food as a medicine, and it's even more specifically like functional foods. And the area that I sort of been interested in, sort of been looking at more is the area of mushrooms. And when I sort of got put onto it, it was more for more additional mental energy. So are you looking in that as an area, or any other sort of those fringe areas where it could be sort of medicinal cannabis and so forth?
Yeah, we looked at medical cannabis a little bit. In fact, we're mainly looking at the endocannabinoids. So these are basically like cannabinoid like things that are produced within the body, and there's a way to actually like make them much more potent. So that's something that we are definitely looking at for various mainly like neurological diseases like Alzheimer's and all. That's where there could be a huge application of this. We haven't yet looked into the mushroom space, but endocannabinoids is something that we are definitely looking at.
Interesting. And as far also on the investment side, one of the things that I love to understand, especially sort of working with as many family offices and many different investment groups that we like to, in that specific medical area, the question I always love to finish on is, in the next 5 years, what do you see as the biggest trends? And how, if we're going to look back at this period, whether it be from COVID, the trends that have sped up and so forth, what do you think are the big winners over the next 5 years in the specific areas that you're working in?
Sure. I can see like robotics to take up, because like even the robotic surgery has been around for a long time, but there are so many new improvements that are coming across now. For example, like there is computer navigation and all, with the help of which you can actually, like, the robots are becoming much more intelligent and agile. Because earlier the robots just used to be programmed by the doctors, but now the robots can actually have a camera on top of them and see the entire space and get like reindex themselves according to the position of the patient. So that's something that we are definitely interested in. AR and VR is there is a lot of scope in that, but like the doctors are still not ready to adopt that, because we actually spoke to a number of doctors and we realized that, because a number of companies come in that area, but like for a very experienced doctor in his like late 50s or 60s, it's not his.
I can imagine that would be a generational change more so than just a technological change.
Exactly. So what's happening is that we can see like a number of these companies are actually now going to medical colleges, and they're working on simulation surgeries, on training of the next generation of doctors. And they actually love it because they're used to playing like video games and stuff. So they really love to learn it. And I think like that, once that generation comes into the workforce, they would be the ones who would be actually using AR and VR for their like day-to-day surgeries. Right now they're just using it for the training purposes, but it's sort of like it has a little bit of stickiness as well. So these doctors would demand that once they go into the workforce, because they are used to getting trained in that environment. So something like in the future we can see like that would be something that's that would take over the world. But in other aspects, I think like precision medicine, personalized medicine, that's something
the personalized medicine part, I didn't get to touch on that part. I was going to say, I was actually chatting with one of our advisors actually sits on the board of NRMA, which is Australia's largest sort of motor insurance company, and they've got a range of, and he mentioned that was a significant area that he thinks will be of strong interest going forward. And because we're all so different, humans are so different in so many ways, and it absolutely makes sense to me that area of personalized medicine will be a massive one.
Yeah, it would be a massive one. One of the challenges that companies are facing right now is that it's not very scalable, like go for each and every patient, it becomes very difficult. But like some of the companies are taking a smart approach of targeting just like chronic disease patients or just like diabetic patients, because these are like long-term patients. They take the same drugs for their entire lives, right? And if you sort of like analyze their personal genetic and microbiome makeup, and then you can like titrate the drug to their needs. You don't need to give them heavy dosages and all if it's not getting absorbed and all, right? So that's something that's definitely the future. And then like elderly care has been in like the topics recently, but I'm not sure. It's mainly out of like a feeling of impact investment and all, and the new generation is getting much more aware about it. But I'm not sure if it would really take up. But like there are definitely the number of investors in this space has increased, definitely. Like a lot
I
of
agree.
are getting, and especially with IoT and all, with cameras and all of that, like there's like smart homes and all. I think that if these things could be integrated with that, I think there could be a future for this, because there's definitely a good need for this in the market. But it's just like the investments were a little less, but there's been more and more awareness that's been going to this field. So let's hope
Yeah,
something works.
gotcha. And one of the benefits of being a family officer, and I imagine being a family of doctors, is, and also your Stanford sort of background and connection, is you get to see, let's call it, access to information and maybe sort of ideas and thinking that sort of most people don't get access to. So if we were to leave on a final note, how do you what are you looking at for your information, and what are your sort of key insights that you've sort of observed over the last 6 months?
Yeah, in terms of information, I think like as every investment manager would look out for, we look for more and more deal flow. So like if it's much more diverse, because like if, for example, we don't get much of a deal flow from Australia, but like if we get to see like the deals that are coming out of there,
we could definitely help you with that.
Yeah, because every geography is completely different. For example,
Yes,
even in big pharma and like the genetic microbiome space and all, like I'm surprised like there's not enough information available for the South Asian people. Like even if you look at Ancestry, like ancestry.com and all, they'll give you data. Okay, you're Indian, but that's it. You don't get anything much more than that, right? So a lot of things have to be done for like the other countries as well. And so that's where there's some sort of information asymmetry, like not enough data is available for this part. And I think in the next 6 months or so, we'll see a lot more adoption for telehealth, robotic surgery, and all. And this is, and even though these companies have been around for a long time, but like and I think we'll see a massive change in the terms of adoption. And I'm really excited about the next generation of doctors. And if they're using AR and VR, I would just be really excited to see like how surgeries work in the near future.
Fantastic. Well, Dr. Ruchi, thank you so much for your time. Once again, I really appreciate it. It is, you just mentioned it's about 9:30 a.m. in Dubai at the moment. So thank you so much for this early discussion, and really appreciate your insights.
Thank you so much, Steve. It was my pleasure. It was a very engaging discussion. I loved it. Thank you so much.
Thank you.